So the session today is on the data use. And I think we talked a lot about data use of IATI in the today and this morning and yesterday. And almost every presentation, every speaker touch upon this issue, which in my opinion is the most important issue. Yesterday, the delegation from Germany mentioned that IATI is strong only if we use the data. And I totally agree with this statement. Yes, we need to work on the quality. We need to ensure the completeness of the data. These are, enablers for IATI. But the ultimate goal is to use the IATI data for different purposes. And that's what our aim. In the last decade of IATI, we spent a lot of time and energy and resources to ensure we have a good database to start with. And that's what's required at that time. Well, I think now we are moving to another era of IATI, is where how can we take this IATI data to the next level, which is to use it. And it's a responsibility, it's a shared responsibility of all of us to really advocate to use the IATI data, even if we don't have the resources, even if we don't have the capacities to do the IATI analytical products. We should advocate. There are always partners who are willing to use it, but they are maybe not aware about it. And this is our obligation as members for IATI to advocate to use this IATI, whether with journalists or academia or think tanks, or even with our governments or parliamentarians. These are essential data. This is the whole core of the transparency, is actually to make it available, and many people should be aware of this data. And that's where the strength of IATI lie. Let me introduce my panel members. Today we have a very diverse members, which actually that's the beauty of IATI. You will see that clearly today from the use cases that we're going to present. We have from private sector, NGOs, government, UN, all they use data in different purposes and in different scope. So let me introduce our members. Alex from Publish What You Fund, and sorry, let me, Mr. Isaka. Mr. Isaka, also going to present to us the USAID cut rapid analysis. And Alex will also represent to us the child marriage report and how Publish What You Fund actually did some interesting analysis on that. And also we have our guest from online, from UNESCO, Yuki. I don't know if we can see you, but welcome, Yuki, to join us remotely from Paris, I think. And we also have Mr. Salio from the government of Senegal. Nice to meet you, Mr. Salio. And we're going to also talk, and we have a pre-recording on one session from World Bank on the global food and nutrition security dashboard. So without further ado, let me give the floor to the first speaker, which is Mr. Ishaka, to really take us on the first analysis, which is on the US cut that happened at the beginning of this year, and how Sierra Leone actually take quick action to see with this USA cut, how they can quickly cover the gaps that created with this cut. Over to you.
Thank you very much. And good morning to everyone. We have something we always say, that when America sneezes, the world catch a cold. So this is not just for Sierra Leone, but for many developing countries. But for me, I believe in this, there lies an opportunity for partner countries, for us to act very, very smart become self-reliant, and be more innovative for us to support our development aspirations. So this morning, we are going to look at the potential loss from the US aid freeze. So imagine a single individual policy, how it affects the global landscape, especially for Sierra Leone. When this particular policy was installed, Sierra Leone as a country, we are able to lose $22.7 million. That was the potential loss. This is an annual average for 5 good years. These are not just numbers, or the 22.7 is not just a number, but it reflects accumulation of a continual partnership. So let's see from our next slide what this number represents. So as we can see from the slide, we decided to look at the 2019 because that was the time we implemented our medium-term national development that speak to not just the poverty reduction strategy, but for economic transformation. So we look at it this way. The 2019, we can see the disbursement for US aid, that it was 18.66. And when you look at our development assistance for that period was 516.22 million. So the contribution of US aid to that of the 516 was 3.6 million. 3.6%. So that is the case of all of this. So when you have the freeze, we are searching for data. Where can we get the data? We contacted the office, the USAID office that used to give us our country data because they are resident partners. It was difficult. What do? We knocked at the door of IATI, and thanks to Mark. We said, this is our case. We need this data for us to know what will be our next step. And when the minister was actually given pressure to the directorate, our director, Madam Abi Kamara, acted so swiftly that we need to do this. The vice president is requesting for this data. Get the data. So Mark, from the IATI team, they actually help us to get the 2024 data as we see. So from IATI, we are able to get 26.07 million as the total money that we are supposed to get from the US aid. But now the single policy will make us to lose this money. So for 2024, we had a total of 498.09 as our total OD. This might be bigger or smaller, but I think might be bigger because we have not included vertical funding. But thanks to IATI, maybe if we are using it going forward, we can see all of those data because they report all of those things. So let's look at the impact. Of course, all of us here are aware that the US aid normally supports the health sector. So the impact was more on the health sector. So we can see that by sector, the health sector has the potential to lose about 88% of the US aid support. Whilst the private sector accounts for 6% and transparency and democracy accounted for 6% respectively. Now, within the health sector again, we went further to break down how exactly this loss will affect this particular health sector. And malaria control accounted for the most of this potential loss from the US aid, accounting to 76%, while the basic health care accounted for 23%. So, as a country, what can we do? So, there are a lot of strategies, but I just decided to measure few because of the exigency of time. So we try to install a lot of measures. The Ministry of Finance implemented our medium-term revenue strategy. In this, there were a lot of reforms they did. And some of these are, one, we'll try now to increase our domestic revenue mobilization. By how? Now in Sierra Leone, I can tell you that more taxes and fees are now paid digitally. We try to ensure that so that we can increase our local revenue mobilization. More taxes are now paid. We try to digitalize all of our taxes so that we try to see how we can collect more. Then there was a fair marking under this same medium-term revenue strategy to see that there is now fair marker that was rolled out so that we can reduce the leakages and improve our compliance. Then, the government also tightened control over duties waivers that is being installed in Sierra Leone. So all of these and some major exemptions, and we are now collecting more fees on non-tax revenues, including license. We are now collecting all of these things because they have been digitalized, and we are seeing how best we can generate or mobilize our domestic revenue. So not only that, we look at our national budget. In 2024, it was 7%. But because of this potential loss, the government has increased the budget for the health sector to 9%. Then, the public investment management team is working assiduously so that we can be able to see how we can rationalize our expenditure so that our development aspiration can be visible. In addition, we are trying to see again, because remember, UNDP supported us in implementing the INFF. So therefore, we are trying to ensure that those recommendations of the IMF and these new global financial innovations, we can see how we can leverage on the diasporal financing, the climate financing, and the private partnership. We are trying to do that. And the South-South cooperation. Just like what my director mentioned yesterday, Sierra Leone is on the verge to get a directorate on South-South and triangular cooperation so that we can see how we can leverage the benefits of that new partnership. So, our recommendation, not just for Sierra Leone, but for all of the partner countries. This is one of the issues where maybe all of us or most of the countries are facing. Database, the aid information system. For us, our development assistance database, which is the DAD, the 6.5, is old. Synergy, our sponsors, they have moved to the IDM 8. But it is very costly to get that new one. So it is good for us to look at alternative wise so that we'll be able to report on our data. So these are a very good opportunity for us to partner with IATI so that we can see how we can leverage on these opportunities. Then, as partner countries, we need to actually look at the financial landscape and try to see how we can enhance the Busan or adhere to the Busan principles on aid effectiveness by seeing exactly where our dollars are being spent. Who is spending this? The principle of transparency, which has been spoken about a lot. the issues of mutual accountability, which has been spoken about, and we see how countries can own their own development aspirations. Then, as partner countries, our governments need to create that friendly environment so that private sectors can come in, because the government can't do everything alone. Private sector needs to come in. And the list is how we can tap on this innovative finance, how we can tap on those innovative finance like the climate fund. You talk of the finance blending. So all of these things is how we can see what we need to do. These are the recommendations for not only Sierra Leone, but as partner countries, what we can do. So I thank you very, very much for your attention.
The third presentation, which is aligning of ODA with the health budget. And here we have Mr. Saliou from Government of Senegal and Mark to present to us their case. Over to you.
Okay. Thank you very much, everybody. And thanks to Shaka for the great presentation, the very practical example as well. And it's fantastic to see all the analysis you did. Okay, great. So thanks everyone for the opportunity to present today. So we're going to talk just briefly about this work which we've started on looking at data in the health sector in 9 countries. This is funded by the Global Fund. The next slide, please. So what's the context? So I think, I spoke yesterday briefly in my intervention about the importance of thinking about when we're using IATI data, not just this question of how do we get people to use the data, but how do we meet people where they're at? And at the moment in the health sector, particularly, in many different sectors, there will be different exercises to understand what different partners are doing in the health sector.
Hello, good morning. Good morning, everyone. So I will be very short. On behalf of Global Fund, I'm really very pleased to be joining IATI and this group of people today to say a couple of introductory words on the data use in the health sector. So health sector is a very resource intensive sector. It is capital intensive, it is labor intensive, and it is also very much data intensive, especially because we deal with health, which is unpredictable and which might need changes based on the diseases that appear, based on individual behaviors of the ones that offer the services or the ones that seek the services. So these are very individual things. And therefore, we really do need to have the data to make sure that our resources are used where they are best needed, in types of places, in types of diseases, in types of populations that for the moment have the biggest burden. On the other hand, health sector being, as I said, a resource intensive sector, will rely very much on data, on the economic situation in the country, on the ability to pay, sometimes on the willingness to pay, on debt levels, debt servicing, economic growth, and so on and so forth. And thirdly, because Global Fund, for the ones that don't know it, is a multilateral financing mechanism that invests during this current cycle about $16 billion in health worldwide, and about $10 to $11 billion in health in the African region, we do have very clear requirements. The first requirement being that the countries and Global Fund co-invest together, and countries to benefit from our grants need to show that they are investing certain amounts in certain diseases and health systems and in certain groups of populations or locations. So this is number one. And number two is that we have a very, very strong fiduciary arm to make sure that transparency is there, that the donors' money and the country's money are coming in sync to buy us the best health outcomes with the least of resources. So now, as we move forward in the current situation, we have agreed with countries that we will support them to be self-reliant. And that requires, first of all, that everybody, not only the donor, but above all the country, has a clear knowledge of what money are being spent where. And that requires the country to be transparent about their health spending, but also the donor to be very transparent about their health spending. And then for information databases or dashboards that bring together all donors, all country data, so that we can make sure at every point in time where we are, what we need to change, and how much money we have. And in this spirit, we are collaborating with ODI and FHEM, and also with 9 African countries that are our partners, to help with this data transparency for health. So from one side, we are helping governments to be able to showcase their national health responses to very granular level. And on the other hand, we are working with all donors so that everybody kind of is transparent for their resources, for their investments, for their level of absorption, so that the Ministries of Health and Ministries of Finance have at any point in time how much money is available, where this money is going, to buy what, towards which locations, which populations, and which are the remaining gaps. So I will let colleagues to explain the project in detail, but I wanted to especially thank the representative of Senegal, which has been the first country partner that has been very enthusiastic and very involved in this project. The other 8 countries have followed, but Senegal has a special place for us because we inaugurated this process with Senegal. Thank you very much for this opportunity, and over to you, colleagues.
Thank you very much, Dr. Tavanashi. So this was Dr. Tavanashi, the names were thrown around. So yes, so thank you. I'm happy that it worked out. So I'm just going to go through the presentation quickly. We also have slides at the back. I just want to introduce 2 colleagues, Muthoni, if people haven't met her already, who's working with me. If you want to raise your hand also, from Emergently, and then also Teresa from Futures Health. If you want to raise your hand as well, great. These 2 colleagues back there, both were working together on this project, and they also have flyers to hand out both in English and in French. So we'd encourage participants to take one so that you can understand more and take this home as well. So yes, Dr. Tavanashi has given us I think the good background and a good information in terms of why this information is needed in the health sector. In every sector, and of course from the perspective of the Ministry of Finance, there will be exercises to understand, what's happening in different sectors. But particularly in the health sector, I think there are very intensive exercises that happen frequently, which are often called resource mapping and expenditure tracking exercises. And often these exercises are very manual and very labor intensive. They're kind of snapshots in time also, so they can be both forward looking and backward looking. But of course, the data can then become out of date also over time, and it takes a lot of effort to then go and update those data sets as well. But it's really important to have this data, right? So what we want to see is how to move away from a process which is slow and costly, and potentially also only covers a limited subset of projects, maybe the largest projects, particularly on budget projects as well that are going through government systems, but maybe it's missing out a lot of information, particularly on off-budget projects which are financed through NGOs and this kind of thing. And you'll see this infographic on the handout as well. So the objective, we want to provide data on projects funded by development partners in a way that ensures both high quality data and sustainability. And this is kind of the vision. I've shown this kind of thing to a few people over the last few days because this is the The first thing I did, I published what you found like 15 years ago, and it was an old data set even back then for Uganda, which includes domestic spending and development partner spending in all sectors, but aligned against government classification. So these are I think these are votes in Uganda, the votes of the Ugandan budget. So health, primary healthcare, there could also be programs. I can't quite remember, it was a long time ago. And the idea is that you can see here for each sector and the subsector, the contribution of both domestic spending and development partners. So that therefore you can make much better, more strategic decisions about, where to invest resources. And we've seen the example, I think, from Sierra Leone of the fact that being able to make these decisions in a very timely way can be really important, particularly at the moment when things are quite in flux. So we have this process, which is, I'm not going to go through, it's on the flyer, I think, as well. But basically, we want to get data that's published to IATI from the Country Development Finance Data Tool. We'll then align this against the classifications in the budget, working with country partners to understand which are the budget classifications which are most relevant in the budget. And then we basically create a mapping table. We'll then generate an Excel data analysis table using pivot tables and things like this. We've been talking, maybe we need to do something a bit more visual as well. Then review the usefulness of data. And this is really where hopefully development partners, you can come in and engage with us as well to then go and respond to some of the feedback that you're receiving from us and from the 9 countries to then go and fix issues in your data as well that are making it difficult to use this data in the health sector. And then finally, in 3 of the 9 countries, we'll also be able to pilot the dashboard that we developed for Liberia and Nigeria in the health sector in those 3 countries. So this is an example of the mapping table. It's a big Excel file on a PowerPoint slide, so it's hard to see. But basically all it is that on the left-hand side, you have the OECD classification, so the sector codes used by the OECD, which are also used in IATI data. And basically you just read across. So for each CRS codes, this is an example for Kenya based on work which we've done with Futures Health to get this mapping table together. And you can see then, okay, according to the Kenyan budget, these are the votes, the programs, and the sub-programs that are the most relevant for those individual CRS codes. So I think sometimes I get a bit too detailed and technical too quickly as well. So on this point, I wanted to ask Saliu, if you would like to also explain from the perspective of Senegal what we've talked about so far, both with the mapping table and also how we think this could potentially be useful from the perspective of Senegal. And then Saliu also has a presentation after this as well, but I wanted to just come to you on this point. Thank you.
Voilà, merci. Donc, c'est la direction du suivi et de l'évaluation des performances des projets et programmes du ministère de l'économie, du plan et de la coopération. Okay. Là, c'est les missions de la direction. Donc, nous sommes chargés de l'élaboration de la méthodologie des instruments de suivi et évaluation de l'ensemble des projets, de coordonner les travaux de suivi et d'évaluation des projets et programmes, d'appuyer l'ensemble des ministères sectoriels dans le suivi de ces projets. Donc, pour chaque ministère sectoriel, il y a un point focal en charge du suivi de ces projets. Par exemple, pour le ministère de la Santé et de l'Hygiène publique, voilà, je suis en charge du suivi de l'ensemble des projets du ministère de la Santé et de l'Hygiène publique. Donc, on va ensemble, avec les ministères sectoriels, identifier les propositions et mesures correctives dans le cadre de la mise en œuvre de ces projets, sur l'exécution des programmes publics en coordination avec l'ensemble des parties prenantes, le ministère sectoriel, les partenaires au développement, et ainsi collecter des données. C'est dans notre ministère que l'ensemble de ces données sont collectées pour pouvoir être publiées prochainement au niveau de l'IATI. Et là, nous allons produire chaque année un rapport annuel de performance. Donc, par rapport à la direction, donc, nous suivons présentement un portefeuille de 214 projets répartis dans 32 ministères sectoriels pour un montant de 12 138 milliards de francs CFA. Et là, on fait le problem solving dans le cadre de la mise en œuvre de ces projets, et les difficultés rencontrées au niveau du financement sont de 25,8%, au niveau de l'exécution des marchés 24,5%, de la passation des marchés 15,3% et 11,8% relatif à la gouvernance. Donc, le cycle de suivi du projet, c'est de la maturation, de l'évaluation ex ante, au démarrage du projet, à l'exécution et à l'évaluation finale du projet. Et que chaque étape, il y a l'ensemble des parties prenantes qui sont mobilisés pour faire le suivi correct de ces projets. Donc, on a un réseau de 162 points focaux, coordonnateurs de projets, 40 représentants les partenaires techniques et financiers qui financent ces projets. Et ensemble, on organise des séances de travail, on organise des rencontres et on a mis en place des instruments de suivi et évaluation, notamment la fiche de projet, la base de données des projets, une matrice pour relater l'ensemble des projets, des problèmes rencontrés dans le cadre de la mise en œuvre de ces projets, un référentiel des indicateurs, une matrice de suivi et une plateforme suivi. C'est la plateforme digitalisée qui permet de faire le suivi de l'ensemble de ces projets. Donc, pour résumer, on a défini 353 indicateurs au niveau des différents secteurs de suivi, au niveau de l'administration publique, l'agriculture, l'artisanat, la santé, voilà, ainsi de suite. Donc, dans le cadre de cette mise en œuvre des projets, donc il y a un certain nombre de propositions et de mesures qui sont proposées pour rendre les projets performants. Maintenant, pour revenir à l'initiative avec IATI, parce que comme l'a souligné mon collègue de la Sierra Leone, avec le retrait de l'USAID, donc le ministère de la Santé et de l'Hygiène publique a été le ministère le plus touché, dans la mesure où 45% des financements de ce ministère étaient assurés par l'USAID. Maintenant, il fallait trouver des moyens pour vraiment prendre en charge ce type de financement. Et avec l'appui du Fonds mondial, on a commencé avec le ministère de la Santé et la nomenclature budgétaire a été envoyée et on avait commencé à travailler entre le ministère de l'économie, du plan et de la coopération et le ministère de la santé et de l'hygiène publique pour faire ensemble les différents programmes dans le cadre de la nomenclature budgétaire. On avait vraiment avancé dans les travaux, mais entre-temps, il y a eu un raménagement ministériel. Donc, le ministère de la Santé a changé de dénomination. Avant, c'était le ministère de la Santé et de l'Action sociale. Et avec le remaniement ministériel, l'action sociale maintenant est logée au niveau du ministère des Familles et des Solidarités. Maintenant, on a le ministère de la Santé et de l'Hygiène publique. Donc, on avait travaillé avec Marc sur 3 programmes. Donc, il fallait revoir ces programmes et des sous-programmes au niveau des 3 programmes identifiés, c'est-à-dire l'offre de soins, la protection sociale et l'administration du ministère. Donc, la nomenclature a été présentée au niveau du ministère de la Santé. On a essayé de faire toutes les modifications nécessaires. On a envoyé par la suite à Marc pour vraiment les observations éventuelles. Il a partagé avec nous. D'ailleurs, même hier, j'ai eu une séance de travail avec Marc par rapport à ces observations pour essayer de voir comment essayer de codifier l'ensemble des programmes du ministère de la Santé et de l'Action sociale afin de pouvoir vraiment bénéficier de cet appui du Fonds mondial. Maintenant, les observations sont présentement en train d'être intégrées par le ministère de la Santé et de l'Hygiène publique. Une réunion de validation sera organisée dès mon retour sur Dakar pour pouvoir valider, comment dirais-je, valider le tableau budgétaire avec la nomenclature de l'IATI, qui va nous permettre, si on va utiliser ces données, de faire cette analyse avec les données de l'IATI. Donc, l'ensemble de ces données, pour le moment, sont répertoriées au niveau du ministère de l'économie, du plan et de la coopération. On est en train de travailler avec le ministère de la Santé pour une harmonisation, parce qu'au niveau du Sénégal, on a l'Agence nationale de la statistique et de la démographie qui fait la collecte de l'ensemble de ces données et qui travaille avec l'ensemble des ministères sectoriels. Maintenant, avec les données de l'IATI, nous allons essayer de valider en amont entre le ministère de l'économie et le ministère de la santé et de l'hygiène publique. Ensuite, nous allons présenter ces résultats pour une validation finale au niveau de l'Agence nationale de la statistique et de la démographie. Et une fois cette étape franchie, donc les données pourront être présentées à Marc pour qu'on puisse vraiment les utiliser dans le cadre de l'IATI. Voilà pour résumer la présentation que j'avais à vous faire. Merci beaucoup, je vous remercie.
everyone actually serving their needs from each perspective. What I want to highlight also, we keep saying when we talk about data use is the quality and completeness of data. These are the two factors preventing us always saying this is the issue. But see, this is a clear example. Didn't stop them. They find ways to get the data first. And from my opinion, is the push factor, which I call it push factor, which is the donors actually putting pressure on whoever receiving the money to publish their data regularly, and also the government. The government has a big role to really play in that. And also they did the triangulation to really check the quality of data. So please, sometimes, you know, you don't have, it's like egg and chicken. We have to make the quality data before we make the data used. No, actually, sometimes you start and then you enhance the quality over the time. You shouldn't stop just because there is one factor preventing you. So please keep that in mind. This is a clear example of how they overcome these issues clearly from just working together and find ways and you know, pressure points to really make this data available and complete.
Okay, so hi, I'm Alex Tilley. I'm the head of research at Publish What You Fund. And so I'm going to just talk today about a use case that we've recently done using IATI data to track funding to end child marriage. And it's also relevant for having UNICEF chairing the panel because UNICEF is one of the main implementers that's working on ending child marriage projects around the world. We worked with an NGO called Girls Not Brides, which is a global network of CSOs which are working to end child marriage around the world. They asked us to look at funding that's going towards ending child marriage and to look at funding over the last 10 years to identify funding trends. We were particularly interested in who the main donors are that are funding this work, how the funding has changed over time, so trends of funding, who the implementers are, so what types of projects are being funded, which countries receive the funds. So there's an atlas that's managed by UNICEF actually, which looks at the rates of child marriage in countries around the world, and we wanted to see how the rates of child marriage align with the funding. Which sectors does ending child marriage projects fall under? And we did some country case studies as well. So just as a kind of, this is the research methodology bit. So we based the majority of the research using IATI data, but we also used some additional data sets. So okay, thanks, yeah. So we used OECD CRS data, and we used a database known as Candid, which uses tax submissions by US philanthropies and US NGOs, nonprofits. So there's no actual specific sector code for ending child marriage, that's made the research more challenging. If there was a sector code, it would actually be quite easy to do the tracking, but there isn't a specific sector code. Ending child marriage does come under the ending violence against women and girls sector, which is one of the OECD sectors, but it's just a sub part of that. So we couldn't just look at ending violence against women and girls. So what we had to do was to use word searches. This is one of the reasons that IATI data is particularly useful for this research, because IATI data has very rich text included with it, so project titles and project descriptions. And we used word searches to look for terms like marriage or ending marriage or early unions and things like that, which identify child marriage projects. Because we used word searches, we had to do manual checking, because when you're using word searches, sometimes projects come up which aren't actually child marriage projects. It might just be describing the context and mentioning marriage as part of the context. It might be mentioning it for other reasons. So we had to manually check all of the projects we found. So we had to read through about 3,500 IATI activities to identify the specific projects we were looking for. And we sorted these into projects where ending child marriage was the primary objective, so it was just an ending child marriage project, or the projects where it was a secondary objective, so it could be a wider project looking at girls' education, for example, or child health or sexual reproductive rights, with ending child marriage as a secondary objective. And then we combined the data sets, the OECD, IATI, and Candid data sets to come up with our findings. So what were we able to find? So we were able to find an overall figure for how much funding has gone to ending child marriage over the last 10 years. We did analysis of implementer types, so whether implementers were multilateral organizations, international NGOs, or local NGOs, and the distribution. We were able to do analysis of the country distribution of these projects, trends of sectors, so which sectors was ending child marriage falling under, and we did 3 country case studies of Malawi, India, and Niger, which are priority countries for Girls Not Brides, where they're thinking of establishing new projects. And for those country case studies, we were able to find detailed information about funders, implementing partners, types of interventions, and results. So I'm just going to very briefly present some of the findings. So the report hasn't actually been released yet. It's due to be released early next year, so I can't give you the overall figures, but this is the trend analysis for the primary objective funding and the secondary objective funding. Just a couple of things on this. So in order to do trends over time, we were only able to analyze up to 2023, and that's because we use the CRS data, and that's the latest CRS data. So in order to be able to be comparable year on year, we could only go up to 2023, and that's one of the kind of challenges with the research. And then you can see that the yellow line is secondary objective funding, so that's increased. And although it's kind of flattened because of the scale, the blue line is the primary objective funding, and that's kind of decreased since 2019. So as the primary objective funding has decreased, the secondary objective funding has increased. This is how the primary ending child marriage funding to India has changed over time. India's got the highest rate of child marriage in the world. The statistics say about 220 million girls are married, or women are married before the age of 18. And the trend here, you can see that from 2019, the funding went down quite significantly. India passed a change to its regulation on overseas aid in 2020, and this kind of reflects the fact that there's less international funding is possible in India since that date. And then this is some other data that we got from IATI, which I think is really useful for Girls Not Brides particularly. These are the implementing partners, so the local CSOs that are implementing ending child marriage projects in India. And this is really useful data for Girls Not Brides, because if they want to set up new projects, these are some of the partners that they could work with. So this is like a really good practical use of some of the detail in the IATI data. And then, so just some of the challenges and recommendations. So at the top there, I've got a table of the different data sources we used and the numbers of projects and the amount of funding that we got from each data source. So you can see that the majority of the funding, about 5 billion, was found in the IATI data, $5 billion US. Candid, that we found about 170 million, and in the OECD data, about 57 million. Just one recommendation coming out of this is that in the Candid data, that we had about 139 philanthropies that were publishing data in Candid, but not in IATI. So I think there's a big opportunity to encourage, these are mostly US philanthropies, and if there's 139 that are doing ending child marriage projects, there's going to be many more that are doing lots of the other international projects we're interested in here at IATI. So there's potential for a lot more publishers. Philanthropic donors are interesting and a really important part of the funding ecosystem. So if we can get them to publish IATI data, that would be great. And likewise with the OECD, we had to use OECD data for 42 donors, which weren't publishing in IATI. So getting them to publish to IATI as well would be really important, because ideally we didn't actually want to use these other data sources. Ideally, we would just use IATI for all of the research, but in order to capture all of the funders that we could, we had to use these other data sets. So this is obviously an ongoing challenge for IATI. And then just a few other recommendations. So consistent levels of detail in descriptions, activity descriptions, titles, objectives. This was really important because we were doing word searches. Obviously, this is really important now as well because if we're going to start using large language models, AI tools, that text-based data is really important. That's what large language models work from. And so increasing the quality and quantity of that data is really important. We have found some inconsistencies with uses of the standard. So particularly where there's places in the IATI standard where you can enter data in two different areas. So with countries, you can enter a country code or a country name, and we found inconsistencies where sometimes one was used or the other, and that just made the research more difficult and complicated. In some of the downloads with outputs, some of the information we were interested in, like implementers and implementer names, are still downloaded with comma-separated values in one cell, and that makes it quite difficult to use. And then we had to use multiple data access tools. So we used the data store, dportal, country development finance data, and data tables, and had to kind of put these all together, which made it complicated as well. So, but overall, we found the IATI data to be really useful. We were able to make some really important findings and produce this research for Girls Not Brides. Thanks.
Thank you so much, Alex. Another example, I think the sky is the limit for the use cases of IATI. The more you learn, you hear from colleagues, the more I think you will have more ideas how you're going to use the data for your own purposes. I hope this can stimulate many of you to really think about how they can use IATI for their daily work. And also, I just want to compliment also what Alex, again, there was an issue with data incomplete, but they look at for other sources and they complete as much as they possible from other sources. So again, it didn't stop them. It's not in IATI, but it's somewhere else. So that's another idea of how to tackle such issues. Yuki?
Yes. Hi. So now I am going to, I think, going to start from the second slide, if that's okay. I hope that everyone heard a little bit. So just to give a little background on where we are and what we work. So we are from the Global Education Monitoring Report, we track education aid. And then recently we asked a new question. So can we just use IATI data to give us a faster and more comprehensive pictures of where education funding is going? And the next slide, please. So GEM report has a mandate since 2015 to monitor SDG 4, so Sustainable Development Goal on education. And we've been tracking education aid since 2002. And then since 2021, we also produced an annual education finance report with the World Bank and the UNESCO Institute of Statistics to give a little more comprehensive pictures of where the education funding is, meaning that the household spending, public expenditure, and the ODA. So the long-term perspective help us track trends and understand how financing flows have changed over time. And we recognize that to get the real-time insight, we need to look beyond traditional data sources. And that's why we actually turn to IATI, please. Next one, please. So for decades, we have been, our primary source of information for tracking education aid has been the OECD CRS, like the other colleagues in this session. And it's very comprehensive and standardized. Yeah, sorry. And overall, according to our research, aid still accounts for 12% of the total education spending globally and 17% of public spending in low-income countries. So looking at the CRS data, according to our research, most major donors actually have a deprioritized education since 2010, and the share of basic education, so basic education meaning primary education, and lower secondary education fell from 40% of the total spending on education aid in 2016 to just 30% in 2023. So you can see how the dynamics have actually changed over the years. However, this traditional the database relying on CRS still has a little bit of limit. So it is still comprehensive. It has the 33 members, official members, mainly from the OECD countries, and it's a mandatory reporting. And it also uses the very standardized the methodology with sector codes, and this includes education sector, and it has a humanitarian section as well. However, the fundamental timing actually is the constraint, as we actually spoke earlier. There is a time lag, so it's about 1 year to 1.5. This means that we are always looking back. So as we already know, that in spring 2025, we heard different donors' decisions to cut aid, and we already had some. We already expected what was happening already in 2024. So we did have more urgency in better understanding where we are heading. And furthermore, because CRS was designed primarily for development data, where the education increasing spans both humanitarian crisis and development program, and the important gaps start to emerge. So price tagging was a little bit weak, and then some humanitarian falls don't make it even to the CRS at all. So we needed a little more systematic approach to capture the full spectrum of education funding in real time. Next one, please. So this is where the IATI comes into play, playing an important role. So IATI, we already know that has over 1,800 actors or publishers, including bilateral, multilaterals, NGOs, private sector, and the foundations. It provides more up-to-date information and transaction level data with broader coverage between the traditional donors. The critical aspect, so this would be a little more about the weakness, is that it is relying on the voluntary and uneven reporting, relying on the uneven reporting due to the publishers' weak institutionalizations of the IATI itself. There's a little bit of, as Steve actually from the previous session mentioned, that because it's an output, it's an output system, so there's a limited validation and quality assurance that is being probably the issue that we can actually talk. Here's what we discovered. So CRS and IATI tell very consistent stories. So CRS provides standardized coding through sector codes and historical consistency spanning over 20 years. So IATI provide more real-time data. So when we look at the same education funding trend through both systems, they do align. So the orange one shows the IATI record, and the blue lines basically show the CRS record. You can see some of them do not actually consistent, and we do have some reasons why. For example, publishers are not always consistent for each donor because the IATI is based on the publishers, not by country. And the CRS has the mechanism to actually combine all of them in one as a one donor. So there are some different reporting mechanisms and lack of coverage, especially for Germany in this case. But we do see the same directions of the data, which actually confirm the consistency and give us a little more confidence in actually combining these two databases. Using IATI data, we conducted the first ever real-time analysis of education aid trend. So we found that aid to education fell by 12% in 2024. And this is the data that is based on the time that we downloaded in May 2025. So that was really right after all those announcement of the budget cut actually came to place. So using CRS alone, this would signal, this would mean that we needed to wait for another year to understand what the 2024 funding would be. But with the IATI, we saw it immediately, and I think many donors work with us, actually reached out for information, and I think this was quite valuable. On top of it, we also combined the data from the donor cut announcement in early 2025 to see where the aid funding is going to head up to 2027. and a total contraction of 25% between 2023 and 2027 was observed. So this early warning system is quite transformative because policymakers and also like practitioners, researchers like us would need to know where this now so we can actually advocate. And like IATI gave us the visibility. Next one, please. Now turning into the education in emergency. And so this is based on the project that the publication that was done with the Education Cannot Wait. It's another UN organizations that funding situation in crisis. And education in emergency and protracted crisis, also I call it EIEPC now, basically spans both humanitarian and the development objectives. And both, there's basically no single database that can provide a complete picture. When, sorry, humanitarian coordinators at the global level, at the country level, need to know how much is being spent on education in crisis, they normally look at this database called FTS, which I'm going to introduce in the next slide. But unfortunately, they cannot easily see the full picture beyond the humanitarian because the FTS is limited for the humanitarian pledge. Thank you. So the IATI, so to get a more comprehensive understanding of the development and humanitarian area, so the FTS, UN OCHA FTS, is the main mechanism. FTS, it's called the tracking, the financial tracking service captures pledges and contributions to UN humanitarian appeals in real time, and then bringing immediate visibility to humanitarian funding flow as they're committed. But when we actually combine these three databases, we could see the full landscape. The CRS shows development funding with historical depth, which also includes both development and the humanitarian. IATI shows both humanitarian development system with the humanitarian marker or education in emergency marker specifically created with. And with the FTS, we also see more humanitarian pledges as they're committed. So the methodology, basically we developed a methodology to analyze education funding across 3 different systems. So we apply, but what we actually apply was the consistent filters. So using education sector codes from 110 to 114 and crisis related keywords for CRS and IATI. And then humanitarian appeal labels for the FTS. And so we converted everything to constant 2025 USD to allow meaningful comparison. So basically what we tried to do was to make sure that we can actually analyze a cross-country analysis using these 3 databases on a specific, on a EIEPC area. And then we also wanted to try whether we could do it by country level and also by regional level. But the perspective was first from the donor, so by donor, and then looking at recipients, so the countries, and then see whether we could actually go into sector specific, and then to see whether the mode of the funding. So using this analysis, we discover something quite important: the education emergencies and the protracted crisis financing is actually rising, while the overall education aid is declining, as we saw earlier. Unfortunately, this chart on the slide actually does not really show, I mean, it is the total of EIEPC financing categorized by humanitarian sector and the development sector. However, this was not possible to actually combine with the CRS to see whether this is the trend that we're going to see for the entire aid sector because of the lack of coverage by the donor. So we have separate figures. One is for EIEPC and the other one is for development. We still are working on how to actually be able to combine these 2 CRS and the IATI data to have more complete pictures of whether one is on development to development aid in education alone, and the other is humanitarian on EIPC and the development on EIE. We're still working on it, but I think we are still waiting also for more donors to publish to IATI so that we have more consistent and more wider coverage of donor presentations in IATI. The message, though, is quite important that the donors are not redirecting resources for towards crisis context because of many prolonged crises happening in the world. However, we also see the shrinking envelope for the aid to education overall. So we do see this is a very important message for donor communities as well as countries who are facing with the shrinking the funding from the donors. So the message from our work is that how the IATI strengthens monitoring. It actually strengthened the way that directly advanced transparency and accountability for sustainable aid, because through time, like real time or near real time transaction level data, IATI enabled donors and recipient countries to track exactly where the funding actually flows. And this transparency built trust and demonstrate that aid is being used effectively, and we really need that for the coming years. So first, the IATI provide visibility that we don't actually have elsewhere. So we actually detected the 12% decline in education aid, and we saw that in May immediately in 2025. And the next, and which actually with the CRS only was not going to be possible. The early visibility enabled rapid response and informed planning. And second, the IATI captures the full funding spectrum. So the humanitarian maker means that we have both humanitarian and development activities in crisis in EIPC area in one database. And thirdly, the IATI reviews the implementation modalities. I did not capture them in the screen, but our analysis also shows that the 64% of bilateral aid flows through project, while only 70% flows directly through recipient governments. And this granularity helps us understand the donor strategies and the partnership models, but at the same time help us to advocate whether the ownership of countries are actually in place. And fourthly, the IATI enables forward-looking analysis, so we can see when donor announcing commitments or cuts and track implementation. We can actually track implementation quickly. And in crisis context, this actually matters a lot. Together with the FDS, funding volatility can also derail long-term education process. But most importantly, across country analysis, the IATI shows that we can actually identify global patterns, and not just within country analysis, but we actually confirmed the cross-country analysis at the regional level as well as the global level is possible, and that translates into a more sustainable aid relationship. To unlock IATI's potential for education, I think we need continued investment and a partnership in data infrastructure and infrastructure. So first, although this is a difficult ask, that we would see aligning the three main reporting system would benefit a lot for the reporting, for the monitoring purposes, not just at the global level, but at the country level, and for donors and for recipients alike. And as we learned that if the IATI is an output and not the, let's say, the system to go through the validation process, then maybe it's our role to actually develop such mechanism in place so that these three global databases can actually align, and we can actually help doing more reporting and making the data available. And for data platforms, so improving reporting standards so they can actually use consistent classifications. In my work, it was quite challenging actually to create a mapping across CRS, FDS, and IATI. I spent a lot of time, but thankfully, because of the prior knowledge of the CRS in the depth, it was possible. But without that, I think it was not probably consistent in terms of combining and making the mapping across three. And for the IATI community, IATI has been a very essential infrastructure for country within country and for across countries. And its value multiplies when reporting standards are straightened and participation broadens and the collaboration improves. So the real power of IATI lies in how it actually creates the community like this, and for the increased transparency and accountability. And I think that there's not the need for more use and more development or more improvement of the collaboration for IATI is never being asked more than now. And thank you so much. Next slide, please. The last slide, please. Thank you very much for your for listening, and you find some resources on this on here. And we look forward for more continuous engagement with IATI. Thank you.
Thank you so much. I think yesterday there was a question given to Yemi saying that why our analysis only focus on country, not regional, not global. This is another example of global analysis, just to answer that question yesterday. But also Yuki mentioned there are several issues that she highlighted in her presentation, which I really want to highlight. And we discussed it in the 2 days ago in the board meeting. IATI, what makes IATI unique is we are bringing the humanitarian and development together. We have real or near real-time information in our database, and we have the forward-looking data. I think these are three components that it's really not all the database, a global database having this three dimensions. And we even requested the Secretariat to look at the vision statement of IATI because these three is not really articulated well yet in our vision statement.
Okay, thank you very much. As Mark said, my name is Teresa from Future Health Economics and Metrics. I'm an economist there, and we're working on the Global Fund project, looking at integrated resource tracking. Now, probably just to mention, here in Kenya, the government has really tried to understand trends in development partner funding, in donor funding, and how the expenditure is looking like. However, there are very many fragmented systems that are being used. So, for instance, we have the NASA, the National AIDS Spending Assessment, we have the National Health Accounts, we have the budget analysis. So all of these tend to be quite fragmented and they're not always consistent. So some of them are brought out every 5 years, some of them are brought out every 3 years, some of them annually. And so sometimes it's relatively challenging to make informed decisions. But one thing that I saw, especially with using the data from IATI, just like the colleague from Sierra Leone said, once the USAID came in and they left the space, there was a very big gap. And in order to understand the true implications, we needed quick data. And one of the things that IATI did was to come in and provide that data. Using that data, it was quite easy to understand some of the repercussions of this decline in funding. And it also helped think through, what kind of new health financing model there can be. What is it that we can come innovatively and think through? What is it that we can do to ensure institutionalization and sustainability? So I just wanted to bring that out, especially that with the work that we've done with Mark. So just kudos to the team, and hopefully there'll be even better engagements that we'll be having. Thanks.
I just wanted to thank the presenters, really. This has been an insightful session for all of us because these are timely issues. We are extremely worried in the development cooperation system, in the industry, the impact of a decline in aid and what it will have on social service delivery. And the studies, the various studies, case studies presented today demonstrate how important it is to have an evidence-based decision-making processes being put in place. And we all put our heads together to try and use IATI data to make real-time analysis to help make the right decision and save social service delivery, which would have significant and paramount impact on poverty because we are reversing human development. Already the trend is very clear. UNDP's latest report shows that 20 years of progress is being reversed already on human development. So what I would like to encourage is this is just the beginning. What they showed us is what is possible to foster this. So if any one of you in this room is very keen to further the study that's been done here by the team who presented or wishes to also share additional use cases, please do so that we can organize a webinar, a dedicated webinar on data uses and learn from each other's work. And then also each one of you use different methodologies and address the difficulty you are facing in from using IATI data. Some of you are more experienced than others. So we can organize such a peer-to-peer learning on how to use IATI data more amongst each other so that there would be a more seamless action at the moment. So what I would like to offer right now here is that the Secretariat is happy to facilitate such a forum, and immense gratitude to all who came today to present. Thank you very much.
Thank you so much, Yemi. You have two offers actually today for free. IATI provided now the capacity building if you want to really, take this opportunity, but also EU in the quality session. Also, they said we are happy to provide peer-to-peer. And I think public what you found. Also, you are doing from time to time webinars to help countries, and users and publishers. So please, we have three offers already from today and yesterday. You can utilize it. If you don't feel that you don't have the capacity, the right capacity, approach these channels to get the expertise. There was one question, and then I'll ask members to really reply to these two questions. Over.
Nous avons déjà utilisé les données de l'IATI il y a pas mal de temps. Et ce que nous avons rencontré, c'est que à un certain moment, il y a un doublon par rapport à l'écriture dans les plateformes, par exemple. Il y a l'Union européenne qui donne de l'argent à l'AFD et ils enregistrent en même temps les données et ça va créer un doublon. Là, c'est 1 et 2D. Est-ce que l'IATI a déjà un plan pour lier les systèmes nationaux pour mieux exporter les données venant des plateformes de l'IATI? Merci.
Thank you. Please, next, yeah.
Merci pour la parole. Je suis de la RDC, je vais parler aussi en français. J'ai quelques préoccupations. Nous sommes pays membres et nous utilisons depuis 2012 les données de l'IATI, mais nous avons des difficultés à valider ces données au niveau pays. Une fois, nous avons tiré les données de l'IATI de la Suède. Nous sommes allés à l'ambassade de la Suède pour lui présenter les projets pour la validation. La Suède nous dit, cette information, ce n'est pas nous, c'est un autre pays qui a donné l'argent à la Suède. Cet argent ne vient pas directement de la Suède. Nous ne les reconnaissons pas. À ce moment-là, nous avons eu des difficultés pour capter cette information. Est-ce que l'IATI, on a toute la journée, depuis la journée d'hier et d'aujourd'hui, on parlait de la qualité des données, on parlait de la transparence, c'est bien, mais cette qualité des données dépend aussi des politiques nationaux. Les autorités politiques ne comprennent rien sur l'IATI. Ici, tout ce que nous parlons ici, c'est sur le plan technique. Nous sommes des techniciens. pour que les politiques valident ces données, ça nécessite un certain nombre d'éléments ou des informations sur la transparence et l'exhaustivité aussi de ces données. Vous avez parlé tantôt ici de l'exhaustivité des données et l'exhaustivité des acteurs. Est-ce que vous pouvez nous donner cette différence sur l'exhaustivité des données et sur l'exhaustivité des acteurs? Deuxièmement, ça c'est peut-être pas une question, peut-être une recommandation. S'il ne faut pas organiser des réunions de plaidoirie entre l'IATI avec les politiques pour leur expliquer l'importance et, entre guillemets, la qualité de ces données. J'ai dit.
Thank you, Zainab. I have a comment from Zahir from African Development Bank, and she says that they have already had a workshop and they plan another one next year. Additionally, that collaboration with the EU is on the table, and she finishes with a comment that let's partner and not work in silos.
Just to briefly respond to the colleague from DRC about validating the data from donors in the DRC. I think Henry this morning spoke about the way that they do that in Nigeria, and that what you could do is try and develop a feedback loop where if there are inaccuracies that are identified by the donors in your country, you can then feed that back to the publisher and get any corrections made. So that might be a good way to improve data quality, is just by directly interacting with the publisher or with the donor and getting them to update any inaccuracies or data missing or any errors that are identified. But it might be good to speak to Henry about how they do that in Nigeria.
I think it's fantastic seeing all these examples, and I think also it's really important, you know, in the context of the USAID cuts. I know that there's been a lot of work that was done at country level by lots of different countries. So I think it's really important and good that that information, that those examples were shared, because then it encourages other countries to think about, you know, how they can do similar sorts of things in future as well. So thank you to all the panelists for kind of contributions on this as well. On the question of of data quality, getting into systems, all that kind of thing. In the context of the health project, I think, you know, we heard from Yemi on IATI this offer and engagement with the Secretariat around data quality. The point from Jules from DRC also in terms of, you know, how do we validate data at the country level? And I think the question is, you know, you have to go donor by donor. That's the way that we've done it in Liberia, right? And I think in the context of the health project, we will have to like develop a clear kind of process and step-by-step approach to doing this. And I think that's going to be really helpful, and maybe an example that could then be adopted in other countries and other contexts as well. So I think we'll be working with the 9 countries and with other partners also to develop that approach over the coming weeks and months. And the final thing on the colleague from Madagascar as well, we can maybe have a conversation in terms of like how you can get the data into system. I wasn't quite sure if it was about getting data into the systems or out of systems as well. But both of those things are possible. So we can maybe have a conversation later about how to do that. So one final thing. My colleagues at the back have flyers. So if you would like to know more about this health project as well, they were both in English and French. So please do grab them from Teresa and Mathoni's side of the back. We're just waving hands as well. Thank you.
So I just wanted to quickly respond to the colleague from the DRC. I think this is quite a very important actually question to that we should actually be able to answer. However, the collaboration between those data analysts and the countries would be more necessary together with IATI. So the answer I wrote in the chat is that this is quite irrelevant. It's probably it happens because the publishers, it's a little bit of a technical term, but the person, I mean, the organizations who can actually respond or submit to IATI is not limited to donors, but it's limited to, also it's open to whoever is being accredited. So it includes donors, recipients, intermediate agencies, and everyone. This actually probably has been the case for the Sweden, that somewhere in the reporting process that might actually probably not be reported by Sweden, but somebody else. And this can be actually prevented by having a clear mapping of who is the donor, who is the intermediate channel and who is actually the recipient. And this is something that we could probably help developing it. That way, the countries who are downloading the data from IATI directly can actually use that to filter who is actually the donor, who is not actually the donor, and who is actually being the reporter. Is it the donor that is reporting this transaction, or is it the channel that is actually reporting on behalf of the donor, or is it the recipient that is actually reporting the transaction? And these are the things that would actually improve the quality of the IATI data itself. Thanks.